Hello, my name is Dr. Carla Renato. I'm a registered Australian chiropractor and PhD candidate in vestibular neuroscience. I'm super excited to be announcing a course that has been requested by many people over the years. NeuroConnect is a 4-part course aimed at providing manual health care practitioners like chiropractors, physiotherapists, and osteopaths the knowledge, skills, and clinical guidelines to enhance the management of patients with neuromusculoskeletal conditions. If you want to sharpen your clinical competency and get better patient results for common conditions like recurrent spinal and joint injuries, headaches and migraines, whiplash, dizziness, and poor balance, chronic pain, as well as provide solutions for the hard and challenging cases, then NeuroConnect is for you. NeuroConnect condenses information you get from expensive programs that can take years to complete, and it does so in 4 15-hour modules. Each module will be both theoretical, but also very heavily practically and hands-on based. I understand that most practitioners don't want to be bogged down in heavy neurology, sort of intricate pathways and knowing which nuclei affects what. Rather, they want to know the relevant parts that are important for a busy practice. They want to be able to integrate all this information and condense it into a clinical paradigm. I've been able to distill and condense thousands of hours of classroom hours, courses, 20 years of clinical experience, teaching for the last 10 years to practitioners across the world, and the latest research in the field from my PhD studies. So if you want the nuts and bolts of how to develop an understanding of brain-based approach to musculoskeletal and spinal care, then NeuroConnect is what you've been waiting for. I'll go through the modules so you have a better understanding as to what each module covers. Module 1 is the foundation in clinical neurology for the practitioner, and we teach this on March 16 and 17, 2019. Really, it's the foundation of why and what we do. Here, we'll help explain with contemporary evidence-based research the connection between the spine and the brain, the brain-based effects of spinal and musculoskeletal dysfunction, and what happens to the brain when we treat and manage spinal conditions. So we know as practitioners, when we work on the spine, we know we get global effects. We want to be able to explain that. So as a group of professionals, we're able to use the latest and proven information to show how effective we are rather than using some outdated theory. We're going to cover the neurophysiology and neuroanatomy of the nervous system so we can better understand how different parts of the brain are influenced and influencing the spine. With this, we'll be able to communicate with our patients better, with our medical colleagues, as well as the community as well. Module 2 looks at the clinical assessment, and this will be on May 18, 2019. Here we'll be able to provide you with a hands-on skills to conduct the best neuro-based exam from a history, physical examination, and neurological examination. You'll also learn how to perform a neuro-based screen and review, particularly for those people that have got busy practices, so then you can correctly identify those patients that need further evaluation. Module 3 is about spinal control, balance and posture, and it'll be held in July 2021. Here we're going to explore in greater detail the bread and butter for most of us in practice, spinal function and performance. We're going to show you how to perform a brain-based posture, spinal control and balance assessment, then follow it up with the latest neurorehabilitation therapies to enhance your existing techniques. So we're not going to be taking away from what you currently do, but adding to your toolbox. We're going to be looking at it from more of a brain-based approach. We'll also discuss spinal conditions like whiplash, scoliosis, back pain, and poor balance, amongst others. Module 4 is the Integrative Management for Pain Conditions, and this will be held in September 7-8. Here we'll explore the most common pain-based conditions to present to your office, and these include things like headaches, migraines, neck pain, and low back pain. We'll explore more of a brain-based assessment and neuro rehab applications that are cutting edge and that will change how your patients respond to their care. So we'll move away from purely a segmental approach to treating these sort of conditions to now more of a top-down or a supra-segmental approach. We'll also be discussing things like stress management, autonomic dysregulation, mindfulness, and nutrition that are there to help manage people with chronic pain. So as you can see, we've got a lot to cover in 4 modules over 60 hours. Whilst each module can be taken by themselves, they can be taken individually, the course really has been designed to run as a 4-part course. So to encourage people to register for all 4 courses, there's a 20% discount if you do so, as opposed to signing up individually. There are very early bird prices that are on offer, which end at December 31st, which save an additional 10%. So really there's no excuse for people who are interested in helping more patients, be able to help more people in their community, to have a different approach to helping people with their spinal or difficult cases, in this case, a brain-based approach. So there's really no excuse that you've got a very early bird before December 31st. You've got super specials of 20% before the end of the year if you register for all 4. So really get on board now. You can find more information at www.brainhubacademia.com.au. And I certainly look forward to seeing you in Hong Kong starting next year. Thank you.